Hello, I'm Dr. Amri Zahed. I'm a heart surgeon and university professor. Today I'm going to talk about the surgical anatomy of the aortic valve. I hope you enjoy. The aortic valve. The heart has four valves: aortic valve, pulmonary valve, tricuspid valve, and mitral valve. The mitral valve is the most posterior, tricuspid valve is the most inferior, pulmonary valve is the most anterior, while the aortic valve is centrally placed in the heart. So the aortic valve, as we can see here, is centrally placed and is in contact with the mitral valve. Valves are flap-like structures that allow blood to flow in one direction. Here is a valve. Here is the aortic valve. The aortic valve is an everlasting mystery to us, to heart surgeons. The aortic valve is wedged between the orifice of the two atrioventricular valves, the mitral and the tricuspid valve. So the aortic valve forms the centerpiece of the heart. Its components are related to all the other chambers of the heart. The aortic valve consists of leaflets, or three leaflets or cusp, and a ring or an annulus. Here are cusp and annulus. Leaflets or cusps. Here are three with some relations. Here are the aortic valve with the three leaflets, and here is the aorta, here is the left ventricle, and here is the anterior cusp of the mitral valve. There is an intimate relation between the aorta and the mitral valve. And here is the left coronary ostium and the right coronary ostium, and in maybe 70% of population, the conus branch has a separate opening, the first branch of the right coronary. So here is the right coronary cusp, here is the left coronary cusp, and here is non-coronary cusp. Again, here is the non-coronary with no coronary ostia. Here is the left coronary cusp, the right coronary cusp. The lateral part of the left coronary leaflet is the only part of the aortic valve not intimately related to other cardiac chambers. So it is related to the external or the free pericardial space. This part I'm working on. Here is the aortic valve, anterior cusp of the mitral valve, and here is the parietal or free wall, and here is the septum, including muscular septum and membranous septum. The valvular leaflets retract into the sinus of Valsalva during ventricular systole, so that there is unrestricted blood flow from ventricle. So blood will go from ventricle to the aorta, but never back. As the ventricle relaxes and the interventricular pressure falls here, blood flow back from artery, filling the cusp of the aortic valve and forcing them to close, leave its closure. So never back. Here is the valve opened, valve is closed. Okay? It's closed by the fluid I put in here. The water I put in here forces the valve to close. Sinus of Valsalva help generating eddy current. Here is the eddy current. So what is eddy current? Eddies of blood passing, closing the aortic valve from side, not from above. Eddy current generates within the sinus of Valsalva are beneficial for smooth coordinated valve function, and it did promote leaflet closure at the end of systole. But what does it mean? So let's go step by step. I'm going to clarify this part. In water flow, eddy current flow opposite the normal flow, especially in circular motions. So here is the water flow in this direction, and here is the eddy current. The eddy current meaning that the water will flow in opposite direction in circular motions. So all the water will go that direction, but the side water will go back in circular motion. This is an eddy current. The aortic valve is here in contact with the mitral valve. As we can see that the aortic valve has no direct attachment to myocardium, while the mitral has direct attached by papillary muscle and chordating. Therefore, their function is generally thought to be passive, responding to fluctuation of pressure between left ventricle and aorta. When the pressure in the left ventricle here down is greater than the aorta, the valve will open. When the left ventricle becomes empty, the blood will go back from the aorta, but never reach the ventricle because the valve will close. It's going to fill the cusp and close the valve. But look at pressures here. Left aorta pressure about 10 millimeter mercury. Here is 120 over 10. 120 over 80 in the aorta, but in the left ventricle it's 120 over 10. Pressure gradient in the left ventricle and the aorta will create a problem. There is a pressure gradient here. Look at this. Between the aorta and the left ventricle, it can create two problems here. In systole, pressure is higher in the left ventricle than in the aorta. So blood will flow from left ventricle to the aorta over the cusp. And it may cause turbulence because of the pressure gradient. Turbulence may produce a murmur. This is what we call it innocent murmur. Innocent murmur is early systolic murmur. This is, we call it benign murmur. The other problem during diastole. Okay? Here the pressure difference, here is 80 millimeter mercury, here is 10. It's a big difference. Pressure is higher in the aorta than in the left ventricle, so blood flow will be reversed. Of course, blood will go back and close the aorta. There is a very high pressure gradient, 80 and 10 here. So what will happen? Closure of the cusp by this mechanism will lead to regurgitation of blood till full cusp closure. Because of high pressure gradient, blood will come and close the aortic valve, but it's going to be regurgitation before full closure. But thanks to sinus of Valsalva, in reality this never happened. Because here, some blood ejected to the left ventricle, here is the blood ejected to the left ventricle, but some of this blood near the sinus of Valsalva will coil back at the sinus edge. Then accelerate, reverse its direction along the sinus wall and form vortex in the sinus of Valsalva before it join again the mainstem. So blood will in the sinus of Valsalva will go in the opposite direction. Look here. Due to this eddy current, the leaflet approximate even before the systole is completed. So during systole, some eddy current will get to the side of the leaflet and push it to close. It begins to close during systole. Good? During systole. During systole, it starts to close by the eddy currents. Okay? Because of this process, only minimal reverse flow is required for final valve closure, and regurgitation never happens. So, when the pressure in the aorta is higher than the pressure in the left ventricle, so the valve will close by minimum pressure. So no regurgitation. This is the rule of eddy current. The attachment of the leaflet are arranged as half moons. Here is half moons. Half moon, half moon, half moon. With the basis of the leaflet attached to the left ventricle, in the left ventricle, and the apex of the leaflet attached to the wall of the aorta. At the sinutubular junction. This is what we call sinutubular junction. Because it is the junction between sinus of Valsalva, here, sinus of Valsalva, and the tube means aorta. So it is sinutubular junction. Aorta junction. Sinutubular junction. Near the cusp, aortic wall presents three dilatation known as aortic sinus of Valsalva. Here is the sinus of Valsalva. So sinus of Valsalva is the space between the edge of the leaflet and the aortic wall. Here is sinus of Valsalva. Here is sinus of basal vacuum. Commissures. A commissure is a place where two things are joined, like here. Here, two leaflets join at a commissure. So this is a commissure, and here is the other commissure. Commissure. Here is the cusp of the aortic valve, and here is the aorta, here is the left ventricle with its thick wall. But what is this? This we call it interleaflet triangles. Because they are between the leaflets, we call it interleaflets. Because it looks like a triangle, we call it interleaflet triangles. Here, between sinus of Valsalva, or from outside, or cusp from inside, and here is the interleaflet triangle. Segmental division of the aorta. We have ascending aorta, aortic arch, isthmus, descending thoracic or thoracic aorta, and abdominal aorta. Coronary arteries arise in most of the cases from below the sinotubular junction. Here is the sinotubular junction between sinus of Valsalva here, tube means the aorta. So here is the sinotubular junction, and the coronary arteries arise below the sinotubular junction. Usually the ostium of the left coronary artery is lower than the right. Here is the right coronary artery ostium, and here is the ostium, and here is the ostium of the left coronary artery. The left coronary artery is lower. And approximately 1/3, I think it's more than 1/3, I see it in my patients. Mostly, all my patients has two separate. A separate opening for corners. Here. So here is the aorta, here is the left ventricle, here is one cusp, two cusp, three cusp. This is sinus of Valsalva, here is the leaflet. And here is the commissure. The leaflets of the valve do not close at the free edge. Here is the free edge. Rather, the closure line is some distance from the free edge and the closing edge. Here, what we call free edge, but here is the closing edge. Between the free and the closing edge are two crescent-shaped areas known as lanulae. Lanulae or lanula, one is lanula, which represents the site of cusp apposition during valve closure. So valve apposition occurs here in the area of lanula, in the yellow area. Okay, here is the lanula, if you can see it. Here is the pulmonary, here is the aorta, centrally placed. Leaflet may be perforated beyond the line of closure in this outer component. This perforation do not produce regurgitation. So you may find in the lanula some perforation, but it does not affect perforation. It do not affect the function of the valve because the line of closure is here. Not here, it's here. At the center of each cusp, the closing edge meets the free edge and form a small fibrous mold. It's called nodule of Arantes here. The nodule of Arantes. The nodule of Arantes here is 1, 2, and 3. Nodule of Arantes. Again, what I'm holding now is nodule of Arantes. The nodule of Arantes provide coaptation area to the corresponding neighboring valve leaflets. So the three nodule of Arantes come in contact together. That means that the valve is competent. As you can see here, they are all at the same point, at one point. Annulus. The annulus of the aortic valve is part of the fibrous skeleton of the heart. Here is the aortic annulus. The leaflets are not supported in ring-like, but rather crown-like fashion, like this. Ring-like, it is characteristic for the mitral and the tricuspid valve, but crown-like fashion, characteristic for the aortic and pulmonary ring. Here is a pulmonary, and here is the aorta. Because of the complex form of the annulus, it is difficult to define a plane in which aortic valve lies. Here is the leaflet, here is sinus of valsalva, coronary ostia, here is left ventricle. There is lack of agreement within the surgical literatures with regard to the nature of ventricular aortic junction, the junction between the aorta and the ventricle. We have the hemodynamic and the anatomical ventricular arterial junction. We have hemodynamic, which is semi-lanular, and anatomical, which is circular. Here is the hemodynamic in red. This is the hemodynamic junction between the aorta and the left ventricle. And here is the anatomical junction between the ventricle and the aorta in yellow. Okay. The hemodynamic junction is it is dictated by the attachment of the leaflet. This attachment is semi-lunar manual, half moves. And this is the attachment of the leaflet. So this is the hemodynamic junction. What is the meaning of hemodynamic junction? That means that all structure on the distal side of this junction are subject to arterial pressure. Here is arterial pressure. Why all structure on the proximal side of this attachment are subject to ventricular pressure. So here is arterial pressure and here is ventricular pressure. The anatomical ventricular arterial junction is circular. Here, black is a circle over which the wall of the arterial trunk is supported by the respective ventricle. Here is ventricle, and here is artery, and here is the ventricular arterial junction. It looks like a circle. So, the attachment of the leaflet of the aortic valve cross the anatomical junction. So the red will cross the yellow. Here is the ventricular arterial junction, and here is hemodynamic junction. So the hemodynamic junction will cross here. Incorporating crescents of the ventricular tissue in the arterial valve tissue here, and triangles of arterial tissue into ventricular bases. So we finally will get crescent and a triangle. Here is crescent and triangle. The crescent is here. It is related to the arterial pressure, while the triangle is related to the ventricular pressure. While the triangle is thin, but it is exposed to ventricular pressure, and the crescent is thick, but it is exposed to arterial pressure. And here is again the famous sinotubular junction between sinus of valsalva, here is sinus of valsalva, and the tube meaning the aorta. Beautiful. Here hemodynamic junction, here is ventricular anatomical ventricular arterial or anatomical junction. Here is the artery, and here is the ventricle. Here is the artery, red, and the ventricle in yellow. And here is artery also. Again, I will remove all the structures here and put it again. Here is artery and here is ventricle. So I'm going to put my leaflet here. And this is the annulus. So the annulus will cross the ventricular part, will cross the left ventricle. So the attachment of the leaflet of the aortic valve cross the anatomical ventricular arterial junction and create a crescent. This is true for the right coronary and left coronary cusp, but except the non-coronary, there is no muscular crescent. For the non-coronary, there is no muscular crescent at the base of non-coronary sinus. So that's why we say that this sinus is exclusively fibrous wall. It has no muscular crescent, the non-coronary. It is an artery and ventricle. Artery and ventricle. Artery in yellow, ventricle in green. So here is artery. Anatomically it is artery, but functionally it is a ventricle because it is exposed to ventricular pressure. So artery as part of hemodynamic ventricle. Here is a ventricle. but it's as a part of the artery because it is exposed to the pressure of the aorta. So it is hemodynamically artery. This is thin while exposed to ventricular pressure, and here it is thick. It is thick while it is exposed to arterial pressure. In the most proximal part of the leaflet here, we can call this virtual basal ring. We can call it virtual basal ring. So, we have here sinotubular junction. We have a hemodynamic junction. We have anatomical ventricular arterial junction, and we have the virtual basal ring. Again, here is the sinotubular junction in blue, and here is the anatomical junction, and here is the virtual ring. Actually, the sinotubular junction, here is the sinotubular junction, and here is the hemodynamic junction, and here is the anatomical junction, and here is the virtual basal ring. Actually, the anatomical structure, the sinotubular junction and the anatomical junction are anatomical structures. For us surgeons, we can see it. While the virtual structures are the sinotubular junction and the virtual. Try to change colors, it's okay. I'm going to repeat it again. We have virtual structure like the virtual basal ring on the sinotubular junction. While the two anatomical structures are two, the anatomical ventricular arterial and the hemodynamic junction. Now I'm going to talk about the aortic root. I just talked about the aortic valve. Now I'm going to talk about the aortic root. What is the difference? Here. This is the aortic valve, while here is the aortic root. What is the difference? Here is the aortic valve, and here is the aortic root. The aortic root delineated by the sinotubular junction, superiorly, and the base of the leaflet inferior. Here. So this is the aortic root, and all the structure here included. So it is delineated by the sinotubular junction above and below. It is the base of the leaflet. Here. It is composed, the aortic root is composed of sinuses, leaflets, commissure, and interleaflet triangle. So let's see what structure we've got here. We've got sinus, valsalva, we've got a leaflet, we've got interleaflet triangle. So this is the aortic root, not the aortic valve. Here is the aortic valve, here is the aortic root. The aortic valve, here is two cusps, but here is the aortic root. We have in this illustration 2 cusps plus interleaflet triangle here plus sinus of valsalva. The aortic root is wedged in the center of the heart. Look here, this is the center of the heart. The aortic root is in the center of this dissected heart. So its components are related to all 4 cardiac chambers. Here is the sinotubular junction again, hemodynamic junction, anatomical junction, virtual basal ring. So the aortic root extends from the sinotubular junction till the virtual basal ring. So all structures here are included. Here is a ventricle and here is an artery. And here is the anatomical ventricular arterial junction. Here is an artery and here is a ventricle again. So its wall is being made of the wall of the aortic root is being made up from 1. Sinus of valsalva, Here. As I mentioned, it extends from sinutubular junction till virtual basal end, so all structures here included. We have here sinus of Valsalva. Sinus of Valsalva. Part of the artery. Sinus of Valsalva is a part of the artery. 2. Inter-sinal fibrous triangle or fibrous triangles. Here. Inter-sinal fibrous triangles. Here. A triangle here. It is part of the artery. Triangle between the two cusps. It is part of the artery. But it is part of hemodynamic left ventricle because it is exposed to left ventricular pressure. 3. Crescents of ventricular muscle at the base of the sinus of Valsalva here. So it is included in the aortic root because, as I mentioned, aortic root extends from sinutubular junction to tell the virtual basal end. It is part of the ventricle. It is thick. Okay. The non-coronary leaflet has totally fibrous attachment. No muscular crescent here. No muscular crescent of ventricular muscle at its base. At the base of the base of what? Of the sinus of Valsalva. So, the aortic root is the sinutubular junction, sinus of Valsalva, the triangles, the crescent, and the virtual basal end. This is the aortic root, very simple, very easy. I'm going to move to other topic. I'm going to talk about the left ventricular outflow tract. Left ventricular outflow tract. Here is the left ventricular outflow tract. Here, the outflow of the left. Here is the left ventricle, and here is the outflow of the left ventricle. The heart is the least symmetrical organ of the body. It is the least symmetrical organ of the body. Here is the shape of the right ventricle. And here is the shape of the left ventricle. As you can see here, that the inlet valve is away from outlet valve, while here the inlet valve is in intimate relation with the outlet valve. I mean the mitral and the aortic. The right ventricle. The right ventricle composed of 3 parts: inlet, apical, outlet. And here is the pulmonary valve. And here inlet part, apical, outlet. While the septum has different arrangement. Here is the inlet septum, here is the outlet, apical septum, and the outlet septum is a very small part. The left ventricle has inlet part of the left ventricle, apical part of the left ventricle, outlet part of the left ventricle. Regarding the septum, when I view it from the left side, I don't have inlet septum. I have those 3 parts, but I don't have inlet septum when I view it from the left side. The inlet of the left ventricle has nothing to do with the septum. Here is the septum, the muscular septum. And here is the inlet of the left ventricle. It is away from the septum. And here is the outlet. So here is the inlet and here is the outlet. The inlet has nothing to do with the muscular septum. I always say to my students this word: the mitral valve is septophobic. It has nothing to do with the septum. It is away from the septum. And during operation, open heart surgery, when you operate in the mitral valve, you are away from the septum and from the conductive system. So here is the interventricular septum, and here is the 2 cusps of the mitral valve. Here is the anterior cusp, and here is the posterior mural cusp. They are away from the septum, separated from the septum by the outflow of the left ventricle. My index finger passes through the outlet of the left ventricle. Here is the outlet of the left ventricle. My index finger passes through the outlet of the left ventricle. Here is the mitral valve, the anterior cusp. Here is the left ventricle. and here is the right ventricle. Here is the mitral valve, here is the tricuspid valve. So the left ventricle, part of the left ventricle is a septal wall, meaning it is a septum. This is a septum and it is part of the left ventricle. And we have a free wall. Here is a free wall and here is a septum. So the left ventricle has a parietal, a free wall, and a septal wall. Here is the aortic valve, wedged in the center of the heart. Here is the outflow tract of the left ventricle. So the aortic valve must be here. Here is the inflow of the left ventricle. Here is the anterior mitral cusp, separating the inflow of the left ventricle from outflow. And here is the aortic valve. Here is the mitral valve, inlet valve, and here is the aortic valve, outlet valve. Here is the aortic valve. I'm going to take the aortic valve out and see the relations. Here is the left coronary cusp, non-coronary cusp, right coronary cusp. As I can see here, half of the left coronary cusp and most of the non-coronary cusp are related to the free wall or posterolateral wall, while half of the left coronary cusp and all of the right coronary cusp are related to the septum. Here, follow the colors. Here is the septal wall and here is the free wall. So half of the left and all of the non-cusp related to the free wall, while half of the left and all of the right coronary cusp related to the septum. Here is the right cusp, here is the non-coronary cusp of the aortic valve, here is the left cusp cut, and it's cut from here. And here is the relation really, look at here, half of the left and all of the non related to the free wall, while all of the right and half of the left related to the septum. Here is the septum, here is the right ventricle, here is the right cusp, left cusp, non-coronary cusp. The anterior leaflet of the mitral valve is related to the left, half of the left and the non-coronary cusp. And the half of the left and all the right related to the septum. And half of the left and all of the non related to the free wall. And here is the right one. The outflow, what is the meaning of outflow tract? Is the portion of the ventricle of the heart through which blood passes in order to enter a great artery. So here is a ventricle, and here is a great artery, and here is the outflow tract. The right ventricular outflow tract, we call it the infundibulum. It connects the right ventricle to the pulmonary valve. We call it the infundibulum. But the left ventricular outflow tract is here, which connects the aorta. Is near. You cannot define where is the left ventricular outflow. Here, this one. The left ventricular outflow tract, here is the inlet and here is the outflow. So this is the left ventricular outflow tract. It is the region of the left ventricle that lies between the anterior cusp of the mitral valve here and the septum, including membranous and musculus. So it is this area between the anterior cusp and the septum. This is the outflow. The ventricular surface of anterior cusp. Here is the anterior cusp of the mitral valve. And here is the ventricular septum, and here is the outflow tract. So the outflow tract here is between, blood will go out from here, between the ventricular septum and the anterior cusp of the mitral valve. This is the outflow tract. Again, here is the outflow tract. Here is the septum, and here is the anterior cusp. I'm holding the anterior cusp here. So this is the left ventricular outflow tract. This outflow tract can be called as aortic vestibule, subvalvular region, subaortic region. This is the outflow tract. The left ventricular outflow tract is composed of a fibrous part and muscular part. Here is fibrous part and here is muscular. The fibrous part, the aortomitral valvular continuity is beneath the non-coronary sinus and half of the left. The relation between the mitral valve and the aortic valve is half of the left cusp and all the non-coronary cusp. Half of the left and all of the So the fibrous component is the ventricular surface of the anterior leaflet of the mitral valve plus the membranous, because they are not muscles. While the muscular component is the muscular interventricular. So it has fibrous component and muscular. The membranous septum is under the right coronary sinus and the non-coronary sinus. Always the membranous septum is here between the non-coronary and the right coronary sinus. And it has a very important, it's very important in surgery because the conductive system and the his bundle basis. We try to avoid cutting here at all. The muscular interventricular septum is under the right coronary sinus and half of the left. So behind here is the muscular component and here is the membranous component of the septum. So we have here is the posterolateral wall and here is the septal wall. The septal wall has two parts, the muscular septum and the membranous septum. And the posterolateral wall has the anterior cusp of the mitral. So here is the septal wall, you can see membranous septum and muscular septum. While the posterolateral wall composed of the anterior cusp, or I mean the ventricular surface of the anterior cusp of the mitral. Here is the membranous septum and here is the muscular septum. Only small part from the membranous. Regarding the anterior mitral cusp have very important functions. The anterior mitral cusp, here is the anterior mitral cusp. Here is the anterior leaflet or cusp and here is the posterior one. The anterior mitral cusp is situated between the inflow and outflow tract, as I mentioned before. Here is the inflow and here is the outflow and here is the anterior mitral cusp. Here, inflow, outflow, and here is the anterior mitral cusp. The inflow tract lies below and behind the anterior cusp, outflow in front of it. Here is the inflow and here is the outflow. Here is the atrial surface, here is ventricular surface. The anterior mitral valve leaflet is situated between the left and right fibrous trigone along the intertrigonal regions. This area we call it right fibrous trigone, and this area we call it left fibrous trigone. It is compensation of the extracellular matrix. Here, left fibrous trigone connects aorta to mitral valve, while the right fibrous trigone connects those three valves, aorta, mitral, and tricuspid. Cause this cusp, talking about herself, because I am a mobile structure, I have to take certain precaution not to obstruct the left ventricular outflow tract. Because it is a mobile structure, because it moves with systole and diastole to close the mitral valve and open it. So what is this precautions? So she's going to use two fibrous trigone and two strut cord. What about the fibrous trigones? Here is the two fibrous trigones. The two fibrous trigones acting as a hinge mechanism for movement of subaortic curtain and the anterior leaflet of the mitral valve. Here is the curtain and here is the anterior mitral leaflet, and we're gonna work the two trigones with one trigone. In that, the two trigones, one and the other trigones, they're gonna make a hinge mechanism, so not to obstruct the outflow. In systole, they're gonna move away from the outflow tract. The two trigones gonna help the anterior leaflet moved away from the outflow tract and closing the mitral valve, so the outflow tract will not be obstructed. And during diastole, we're going to move to the opposite direction to allow blood to enter to the left ventricle from the left atrium. Here is systole and here is the stole. Back in systole, not to obstruct the outflow tract, and it can obstruct the outflow tract in diastole. It doesn't matter because already we need the blood to go in and not out. Two strut cordi. Here is the two big strut cordi. Thick cordi. Strut cordi is characteristic for the anterior leaflet of the mitral valve. There is no strut cordi in the posterior leaflet of the mitral. What is strut? Strut is a structure component designed to resist longitudinal compression, like this. This is strut. To resist longitudinal compression. So they stay away from each other. So here is strut. The strut chordae, the two thickest chordae insert into ventricular surface here, restrict the anterior leaflet from obstructing the left ventricular outflow. This strut prevent the anterior leaflet to obstruct the outflow. Here is strut, the thickest chordae. So what is the line of demarcation of the left ventricular outflow tract? What do you think? We have again, here is the septal wall, muscular septum, membranous septum, and here is the free wall with the anterior cusp joining. There is no line of demarcation on its septal wall to indicate the lower border of the tract. There is no line of demarcation here. There is line of demarcation only on the free wall. Here, we can consider this as line of demarcation. This is the lower border of the anterior mitral. The left ventricular outflow tract and the conductive system. This is a very important issue, especially to surgeons. Of course, I don't want any of my patients go out of the operating room or go out of the theater with complete heart block. So I have to understand the anatomy of conductive system. Here is the membranous septum, and here is the left bundle branch. It is related to the membranous septum. So please don't put your scalpel here anywhere. Don't cut in here, never cut in. Here, membranous septum, and here is the left bundle branch, and right bundle branch, and here is the membranous. This is called the crest. And this is the Hess bundle and left and right bundle branch. So, if you want to do myectomy, please do it here. Stay away from the membranous septum. Do it here, at the junction between the half of the right till the left coronary cusp. Yeah, this is real. The nicest place in the world is to be in someone's thoughts. And I love to be in my lovely wife. Excuse me, I talk too much. I hope you enjoyed the lecture. See you.